You don't want this to happen to you, but there is a superficial layer that can come out. So we have superficial layer muscles, and we have a deeper layer muscles, and it's all collectively known as the pelvic floor. But what's not showing here is all of the other ligaments that connect bone to bone, and all of the other buttocks muscles and hip muscles that all work together around the pelvis to help stabilize it and get it to work together. And so there are actually 35 different muscle groups that attach to your bony pelvis, and we want them to all be strong and supple. I'm going to pass the pelvis around. I'm going to leave that part off because it always falls. But, you know, sometimes it's just interesting to look at up front. If you will, like great, just pass that along. But we're going to focus a little bit more on the pelvic floor itself. So that bowl of muscles, you guys are all sitting on yours right now. So what I want you to do is get your feet solidly on the ground. And I want you to rock back and forth in the chair a little bit and feel your butt bones on the chair. Okay? When we contract the pelvic floor, our butt bones should stay, we're doing it sitting, our butt bones should stay on the chair. And I want you to think like you're trying to lift your vagina or your anus, or both, up off the chair. Okay? So it is a hidden exercise. If you feel yourself kind of bounce out of the chair, or your legs start to come in and out together, we're using different muscles. We're using either the adductors or the buttocks muscles. Okay? No one should know that you're doing it, other than I just said, let's all do it together. And everyone tends to like stare off into the distance. Oh, I found my pelvic floor. Or, I don't know what this lady's talking about. I don't feel anything happening. If you try contracting it, and you don't feel it in the sitting position, when you go home tonight, or feel free to right now, lay down on the ground and try the lay down position. Sometimes when we're upright like this and gravity's beating straight down on it, it's really hard to feel it contract. But when we go and lay it on our back or our side, our pelvic floor is pointed this way and gravity is going this way, so it might be easier to feel it. Another way that you can test it and see if you are contracting the right muscles is when you go home and you're going to the bathroom. You can do this as a test, not an exercise. Try to stop the flow of urine midstream. Everyone should be able to stop the flow of urine midstream. You don't need to do this, or you shouldn't do it as an exercise back and forth, because we are designed, there's many reflexes that help to just get us to let go and pee. So we are designed to sit down, let go, relax, and the pee come out. So if we do a bunch of start and stop, that actually can screw up some of the reflexes in our bladder and can get us to back urine up into the bladder, and the worst case, back urine up into the kidneys, and we can end up with urinary tract infections if we do that a lot repetitively. I bring that up because at least once a year, some woman's magazine says, are you doing your Kegels? You should do hundreds of Kegels while you're sitting on the toilet trying to start and stop your flow of urine. No, you can do it as a test. You should be able to stop it. If you can slow it down, your muscles are there, but they're weak. Sometimes you divert it. Sometimes you get a nice stream down the center, and you contract, and it goes way off to the side of the body. That means one side of your muscles is working better than the other side of the muscles, okay? And sometimes you try and you can't get it to stop at all, okay? That's when you call me, because you're having an issue finding those muscles, okay? Especially if you're dealing with some of the issues that we're gonna talk about, that's when you potentially might want to partner with a pelvic physical therapist. Before I move on to talking about how it relates to the workout, one other cue that either one makes people laugh or two helps people find and use their muscles better is when you're thinking about contracting, I want everyone to imagine a blueberry at the entrance to your vagina. I don't know why it's there, but we're going to try and pick it up with our vagina. So when you're contracting your pelvic floor muscles correctly, they kind of lift and squeeze at the same time, okay? So you can think about picking up a blueberry versus squishing it really hard or pushing down on it. You want to try and lift it up. That's a cue that works for a lot of people, or at the very least, it's going to make you think I'm really weird that I told you about that. So, I'm going to change course for a second. I was going to talk about pelvic floor workout, but I'm going to talk about what I call the core canister first, because it is involved with what we do with our workout. So, the pelvic floor muscles, although the medical community, what you will read about online, is going to tell you that it's all about Kegel exercises and it's all about just making sure your pelvic floor works. That's BS. No muscle group in our body works in isolation. Our pelvic floor is the bottom of our core canister. So think of a soda can Diaphragm's the top of the can, abdominal and back muscles are the sides of the can, pelvic floor is the bottom of the can. You want all parts of that can working together, okay? So when your lovely coaches here are telling you that you're working your core, it's not just about your abs. It's about your breathing, your pelvic floor, your abdominal and your back muscles, okay? All of that is part of your core canister. And so I spend a lot of time in my clinic helping people connect all these muscle groups together. And our breath is a really good way that we can connect it. So, quick quiz. When we take a deep breath in, I'm inhaling. Should my belly go out or should my belly suck in? Who votes belly goes out on an inhale? Who votes belly goes in? Who doesn't want to vote because they don't want to be loud? All good, all good. And I can't count your vote because but so when we inhale, we actually have more than 50% said belly goes out when we inhale. That is correct. But we women like to do the opposite. How many times have you caught yourself going, yeah, doing good now? We like to suck in and hold. We suck in here and we suck in here, and that feels very pressurized. And it can actually feel really stable, but we're not using the muscle groups well. We're stabilizing with pressure. So if I go back to that soda can analogy, so think of a soda can. Soda can walls are really weak. You can crush a soda can when it's open, but when a soda can is closed, there's all this pressure pushing out on the wall. You can't crush a closed soda can. So it's one way that our body can kind of cheat for us to stabilize, and we can pressurize here, okay? And that's where some people kind of get stuck when they're doing a lot of core strengthening exercises. They're like, I feel like I've been doing this forever, but I'm not getting stronger in this particular area. You might be using pressure to stabilize. We're going to talk about that as some of the signs of dysfunction. But coming back to it with the breath, that when we inhale, I like to think of us as a balloon. So as I inhale, everything's going to expand and fill, and it's not just pushing my belly out, I'm expanding all the way around. I like to think of an umbrella opening up. I'm even opening on the back side, all of that's opening up. And as I exhale, that's all coming back in. Now when we're just doing like, you're sitting here watching me and you're doing just light breathing, you're not going to feel a lot of big movement there. But when you try and take deeper breaths, you should. And if you think I'm lying, go home and watch your pets breathe, or watch little kids breathe. And that most of them do it correctly. It's not until we get older that we tend to get a little wonky with how we breathe. And that, but big, slow, relaxed breath where we let everything expand out. And then as I exhale, everything kind of recoils back in. So it's a great time to brace or activate my abdominal muscles, and at the same time my pelvic floor comes in too. So both of them kind of come in together with an exhale so that I can create a nice strong brace in my belly and my pelvic floor, that whole core canister. So that's my ready position before I do any kind of heavier lifting, is that kind of core brace to kind of get things going, but timing it with my breath. Does that make sense? Or does anyone have any questions about that kind of core canister and how it all works together? Because too often people think, oh, I'm coming for your pelvic floor lecture. She's going to talk to me all about just the pelvic floor part of it, but it doesn't work in isolation, and that it all has to work together.
Is there a way that we can practice to know, like, is it best to practice that breathing technique when you're laying on the floor or against a wall, so that you can kind of like feel that you're doing it the right way?
So the hardest position to do it in is standing, because your body's working to keep you upright. So that would not be the first position that I'd start with. I would start either laying down or a relaxed sitting position. So you can actually do it here, like all you kind of like sit and kind of lean back into your chair a little bit. You can either put your hands on your rib cage or top and bottom, okay? So what we want to go for is, if we're top and bottom, a little bit of movement here, more movement down below. If you're rib cage, I want you to think about like opening up like an umbrella. Okay, so neither's wrong, it's just different ways to kind of think about it. So everyone take a big slow breath in, let things expand out, and then as we exhale, we should feel it come back in. It's small, it will get bigger when you're laying down. I'm standing and I don't do it as well as I should be, so mine's going to be very small. So I lean back against the wall so I can make it bigger. But it's something good to practice in a sitting down or a laying down position first, especially if you're not feeling it much, take it to laying down. But instead of just doing the breath with it, this next time when you do it, when you go to exhale, what I want you to think about doing is drawing your belly in a little bit, like you're trying to pull your tummy away from your underwear, and think about doing that pelvic floor contraction a little bit on the exhale. So we inhale and let everything relax and expand. And as I exhale, the pelvic floor goes in and my tummy comes in, okay? That is the way to kind of get it on the deepest when you're doing it with an exhale. Now, these muscles should be able to work anytime, but I usually spend a lot of time working with people to try and time it with an exhale in the beginning to kind of get used to it. Especially if someone's a breath holder or used to just pulling it in all the time. We work a lot to get it used to their breath. Yeah?
What about when you sneeze or when you cough?
So when you sneeze or cough, it's one of the most pressure-filled situations down through your bladder. So you go like this. There is something to be said for bringing your legs closer together. It gives a little bit more support from below, but the pelvic floor muscles are a trampoline that should accept the load and come back. But anything that's super pressure filled like that can put potentially more load down than the pelvic floor can accept back up. And that's when we end up having a problem, is a pressure versus load situation. Some things that work for people is if you have warning that a cough, a laugh, or a sneeze is going to come, stop in place and do what we call the nap, or a pre-engagement of the pelvic floor. It's almost like you're telling the pelvic floor trampoline, like, hey, something heavy is about to bounce on you. Could you be ready? Okay. It should do that automatically, but as we age, it loses some of its elasticity. We can have some faulty movement patterns that can contribute to it. We can hit menopause and we lose estrogen, and it loses some of its fluid content and some of its strength. All the fun things we women get to go through, but there are ways that we can prevent that and strengthen it. But in that moment, think about doing a stop and a little pre-contraction if you can, to try and brace against it a little bit. Okay, that's kind of a quick and dirty version of what you do. There's a lot more that we can do depending on what's going on in that person's particular situation. But good question. Alright, so 10 signs that your pelvic floor is affecting your workout. You leak some while you're working out. There are some videos out there that are like, woo, look at how much she lifted. She just did a 200-pound deadlift, and yes, she peed the floor, and they're applauding it. That is a sign that your core canister is not working in the right way. Now, I want women to lift heavy. I want you to feel strong and be active. But if you are leaking while you are working out, that is a sign of dysfunction in this core canister. And we want to change that before it becomes something bigger. Because when we're talking about the core canister, bladder leakage is one symptom. But as you're going to learn here, it might start showing up as hip pain, I did that backwards. Back pain, hip pain, pelvic pain, tailbone pain, pain with sex. So I had a patient one time who didn't come to see me until she started having pain with sex with her partner. But we started going through her entire history. She was overweight. She started a running program about 1.5 years ahead of seeing me to try and get in shape. Had never really run before. Had weakness in her hips and her core muscles. Started noticing some hip pain with running, but wanted to keep pushing through it. Then her back started hurting her too. Then she leaked a little bit with running. And the final straw was, she's like, I can't have sex anymore without it being painful. And that's when she came. And that was like 8 months later, after all of her symptoms started. So the initial for her was it showing up as hip pain. But she just wrote it off as like, well, I haven't exercised in a while. And like, if I just keep running, it's gotta get better. But running doesn't necessarily strengthen hips, that's a different talk. But like, you want strong hips to run, you don't want to run to try and get strong hips. The opposite doesn't work. And I just went on to number 2. So low back pain, abdominal pain, buttocks pain, hip pain, tailbone pain, those can all be signs that your pelvic floor is not working appropriately. Okay? I can't tell you how many times in our practice we will see people who have done therapy for some of those issues, and it got partially resolved, but not fully resolved, because that therapist wasn't trained to look at the pelvic floor, and so didn't look at it all as a whole. Now, don't get me wrong, I see that portion of the population. There are many people who go to my wonderful orthopedic colleagues who can get better from their back pain and hip pain. But if you got a persistent one that's not getting better with the usual therapies, and no one's talked to you or looked at your pelvic floor, that might be part of the issue. Okay? Needing to pee pre and post workout. So who ran in here and said, oh crap, Aaron's doing a workout, I better use the restroom before we get started, okay? So if you always need to empty your bladder right ahead of the workout, or you get done with the workout, especially if you only did a 20-minute workout, and you're like, oh, I gotta empty my bladder afterwards because all that jostling around made me feel like you need to go. Our bladder, with us drinking a normal amount of fluid during the day, should be able to hold it and let us go every 2 to 4 hours. So if you come to a class and you're here for 50 minutes to an hour, and you go before, and especially if you go again right after, you're going too often, okay? And the working out might be a trigger for you with it, okay? Some people do it out of habit. Our bladder can't train us. I've seen the little commercials of I forget what med it's for, but the little bladder like leading the woman to the bathroom all the time. Yeah, the bladder can train us, but equally we can train the bladder. Okay, so if you feel like your bladder's in control, there are things you can do to train it out of control, you back in control. Another symptom that people may feel either during the workout but more commonly afterwards is a feeling of pressure, heaviness, or fullness in the pelvic area. That can be a sign that your pelvic organs are falling or tipping into the vaginal canal, and that's called pelvic organ prolapse. I don't have any of my pelvic organs in my pelvic bowl, but your bladder can kind of tip back into the vaginal wall, your rectum can tip forward, your uterus can come down. Even if you've had a hysterectomy, your cervix can come down. Many women wrongfully think, I've had a hysterectomy, I do not have to worry about pelvic organ prolapse. Actually, no, you're more at risk for it because you've had surgery in the area that's messed with all of the internal structures. You are still at risk, and that is actually a risk factor for developing prolapse. So I always hate that one when doctors be like, yeah, you're good, you'll be good for life. It's like, no, you won't, because you never taught them how to lift properly or how to be active. And I'm getting on my soapbox. But too many doctors who do surgeries like a hysterectomy or prolapse repair say, okay, you're good, never lift more than 10 pounds for the rest of your life. Like that's so unrealistic. Like, and I have a 35-year-old mom with 3 little kids, 1, 4, and 5, who has been told that from her surgeon. And I was like, how do you tell a mom of 3 who has a 1-year-old at home that never to lift more than 10 pounds?
Right.
It's just not going to happen. Instead, send them to a pelvic physical therapist to learn to lift like this, and then transition them into like a fitness facility so they can continue to learn to lift well. Sorry, soapbox. But I think we can do so much better to help people be active and not feel symptoms that way. All right, so pelvic heaviness, pressure, falling out, feeling either during or after a workout is a sign of pelvic floor dysfunction. Coming back up to the belly. If you feel when you're doing exercise, especially if it's a core exercise, and you're like, oh, the cool, this is gonna give me flat abs and give me really strong figure. If your abdomen is pushing out really, really far with the activity, it is not gonna get you flat abs, okay? It might be a really good core exercise, but if the only way you can do it is to push out, and especially hold your breath with it, you're using pressure to stabilize, you're not using those muscles well, and it will never get you flat abs, and that until you change that holding pattern. So sometimes it's just a pattern that you might not be aware that you're doing it. So kind of the next time you guys go through your core exercise, just pay attention. Like, hey, was I able to kind of keep my abdominal wall braced in a little bit and talk while I'm doing this? Might not want to talk a lot, but can I talk? Am I breathing while I'm doing it? Cool, that's great. If you have to hold your breath or push your belly out, you're using pressure to stabilize. And when you put pressure on here, you can also put pressure down here. And over time, that trampoline can get a little worn out from all that extra pressure. Okay? All right, talked about peeing before and after a workout. hold 2 to 4 minutes. Woo! That is big. Wow. What'd you get? That's nothing. I was in bed all day. To every 2 to 4 hours. If you have to stop your workout to pee, that's the sign that you might be having a dysfunction. Okay. Now I'm not talking about the crud. Aaron threw in a bunch of jumping jacks. Okay, let's go all wait in line for the bathroom before the jumping jacks happen. That's just more of a worry that you're gonna leak. But if you really if you get the urge to pee mid-workout, that's a faulty signal. Your body, I'm not saying you're not getting the urge, I'm just saying that your body should be able to hold for an hour-long workout and not give you the urge to go. Okay? Kind of talked about with the belly bulge, but holding your breath exercise. When these lovely coaches tell you to breathe with exercise, they're not just being mean. There is a reason behind it, is so you don't create that pressurized canister. I saw a lot of you, especially when you were doing overhead pressing and some of the deeper squats and that, you guys were doing a great job of, we call that exhale with exertion at our office. Whenever you feel like you were doing the hardest part of the motion, blow out with it. 1, it takes pressure off your pelvic floor, and 2, if you remember from way back at the beginning, we talked about that when we inhale, we let everything relax a little bit. When we exhale, we engage. So if we train that to happen, and we do the exhale with the exertion, we're getting good core engagement, and we're taking some of the pressure off the pelvic floor. So if you are doing an exercise and you find you can't do it without holding your breath, raise your hand and ask for a modification. Because your legs might be able to do it, or your shoulders might be able to do it. Your core is not doing it right. And you want to make sure all parts are working along the way, okay, so that they all work together. All right, form failing or feeling exhausted. Now, don't get me wrong, we're going to be tired after a workout or that, but if you just really feel man, I used to be able to knock out 30 of these at this weight, and I was feeling great. But now you're feeling it's really hard work, or you lose your form 10, 15 reps in, or you just can't do as many as you used to without it feeling kind of wonky. That might be a sign that your core canister is I can't do this anymore. I did it for a while, but now I got some dysfunction going on and it's problematic. Okay, so that was a little bit trickier, but especially if it's something you used to be able to do and now you're feeling more exhausted or tired with it, that's a sign that your body's having to work a lot harder because this isn't doing its job well for you. I don't know if you guys let this happen here. Do you skip part of your workout because of you're fearful of leakage, or you'll leak if you do it? Do you self-modify? You're everyone else is doing jumping jacks. I'm gonna tell Aaron my knee bothers me, and I'm gonna do something else over here. So do you? I had a patient just 2 weeks ago who she was kind of funny. She's I don't know why I'm here. My doctor said I need pelvic physical therapy, but I'm not leaking. I was okay, that's great. I'm glad you're not leaking. I'm glad you're here, though. Let's talk a little bit more. I was well, what do you do for fitness? And I used to go to the gym, but I don't do that anymore because I leaked with all my exercises. There we go. So you can self-limit and start doing less and less and less because you're fearful about what your bladder is going to do. And it's one of the most common reasons that ends women up in nursing homes is bladder issues and how their body responds to doing less and less and less. So we don't want our bladder making us do less and less and less. So if you find yourself taking a pass on certain exercises that are on the docket for the day, that's a sign that yes, you're not leaking, but it's because you're avoiding an activity. Okay, so kind of take a serious look if you avoid anything because you're worried about your bladder. On door number 2, are you unable to control gas during a workout? So sometimes it's not a bladder issue, sometimes it can be a bowel issue. Most commonly it's gas control. On the more severe end of it, it can be fecal smearing or feeling like you suddenly need to go have a bowel movement. Now lots of factors play into why we might have leaky bowels, but the gas passing and stuff like that can be a weakness of the pelvic floor kind of showing through. So if you're it's not as common in weightlifting type stuff, but when you're going out for walks and stuff, and you're whoo, I can't control that anymore. My mom liked to call it barking spiders. And I was okay, great, I just won't walk behind you, but no. My mom did So, but yeah, so yeah, it doesn't have to be a bladder issue, it doesn't have to be a pain issue, it could be a bowel issue. Okay. So those are the 10 most common signs that I see that your pelvic floor might be affecting your workout, wow, been a long day. So I wanted to leave, did I leave some time? I don't know if I, oh, right at 8. Wanted to leave time for questions and stuff. I have this all as a nice little handy dandy handout for people, but I didn't have a color printer. It looks really pretty in color, I promise. And I can email it to you guys in color, so if you want me to email it to you, you can put that on there. I also put on there that oftentimes this kind of brings to people's mind like, she talked about a lot of things that I might think I want to see a pelvic physical therapist for. If you want to talk with one of, it's myself and 4 other pelvic physical therapists, 3 doors down, we're happy for you guys to set up what we call a free discovery session. You can come in and chat with one of us to talk a little bit more about what's going on with you and see if pelvic floor physical therapy is a good fit for what's going on so that you can continue to work out the way that you want to. But I'm going to stop talking now and open it up for questions. So, any questions? Yeah?
Do you need a prescription to come to you?
Not since 2023. Missouri did change the law. Insurance companies don't necessarily always follow along with that, but the simplest version of that is no. We can do the evaluation without any type of a prescription in place. If we are seeing you, because Missouri is, we are the show me state, so they didn't let us just do free for all. I can see someone for 30 days or 10 visits, whichever comes first, and at that 30-day mark, we need to be making a clinician aware that I'm continuing to work with you, or we need to have a prescription in place that says evaluate and treat for pelvic physical therapy. That's good for like a year. So the simple answer is no. You don't need to go talk to your doctor. You can't just go directly and see a physical therapist. At our facility, we'll ask you if you have one, just to see if it's there, and at our facility, we'll ask you like what insurance you have, because certain insurances do still require this. They get to set their own rules. So, did that answer your question?
Yes.
Okay, perfect.
I just had a hysterectomy in November 4.
Okay.
Like how long, like do I ask for, do you know what I mean? Like do you do it afterwards or do you like, I know, like do you?
Alicia and I were talking about that.
Yeah.
So my soapbox is that I think, so if anyone has had like a shoulder surgery, ankle surgery, knee surgery, or injury and has gone to physical therapy, raise your hand. If anyone has had surgery in this area of their body and gone to physical therapy, raise your hand. A lot less people, but there are, like, I was surprised that we got that many, so I'm very happy about that. We do surgeries in this area of our body, and they say, recover for 6 weeks on your own at home, and then cool, you're good. Go do whatever you want, except don't lift more than 10 pounds, sometimes. So, unfortunately, our medical system does not do a great job of saying, you should go do rehab afterwards. I had gallbladder surgery last year, 3 small little holes in my belly, and I did therapy with a couple of my therapists at my clinic and did our soft wave therapy to help make sure that my scars healed well and then my abs came back. And I know what I'm talking about. And I still wanted help from someone else to do it. So I really feel like our medical system is doing a disservice by not sending people to pelvic physical therapy for at least a visitor show afterwards. We are actually doing later in October on a Tuesday, not like so, like the 3rd or 4th week in October, we were doing a hysterectomy prep class. That's a free class. We're doing it at the end of September. On the 3rd, next Tuesday, I'm doing a prolapse surgery prep class. So that's one of my areas. I'm trying to do these surgery prep classes monthly for people. So it'd be right before your surgery or that, but it would be a great class for you to come to. And then so it's on our events page on our website. And that, so I don't know if the sign up's live just yet, but it will be.
But then I should ask my doctor or my surgeon.
You most likely, if your surgeon tells you to go to therapy, tell me who that surgeon is.
Okay.
Live and flowers and that, but you will most likely have to ask.
Okay.
And honestly, they will most likely be like, you're gonna be fine. Like, just, rest and recover. So, again, like she said, you don't need a doctor's prescription to come see us. We will want to know, when does your surgeon feel like it's scars need to move. Scar tissue responds to the stresses that are put upon it. So the simplest way to explain it, you guys ever seen the game Pick Up Sticks? It's an oldie but a goodie. Like, we don't give people like straight up sticks to but like that's how scar tissue lays down at the beginning. All jumbled up all different ways just to cover the wound and start the healing. But then eventually what happens as it remodels is it needs to respond to the stressors put upon it. So the knee is the simplest example. If I fall down and scab my knee, at first it's not going to move very well, but I'm going to keep walking and I'm going to keep moving, and I need my knee to be able to stretch this way. And so as I do that, the ones that don't line up that way start to break off, break away. But especially scars in the pelvic area, so C-section scars, episiotomy scars, natural tearing scars in the vagina, my scars for my gallbladder surgery and laparoscopic surgery. They're like, most of the times the surgeon's like, looks good, healed. You never touch it, they never tell you to touch it. There's so much we can do to get them moving, even if they are old scars. It takes longer if they're old scars, but you can still get old scars moving. At our facility, we do dry needling, we do cupping over scars. We have our new shockwave machine that's called a soft wave therapy that helps to break up the scar tissue, get blood flowing to the area, helps the body to realize that this is an area that needs healing and tissue movement. So we've been using that a lot more. We've had it for about 8 months now, and it's been really helpful. So we love working with scars because they should move more. And it's one of the things they teach in the classes, the surgery classes, is like, this is how you should mobilize your scars once they've closed up. Good questions. What else? One that usually gets asked that no one asks, what do you do in pelvic physical therapy? So, quick overview of it. Lots of talking in the beginning to figure out what's going on with you, what you've tried, what's worked, what hasn't worked. Followed by we do like whole body, top down evaluation of the posture, how you're moving, what your hips are doing, back's doing, what your abdominal scars are doing, what your abdominal muscles are doing. Do you have any abdominal separation? How's that all working together with your breathing? Second part's the internal examination. So with your permission, have you undressed from the waist down and insert one little finger into either the vaginal or the anal canal, depending on what's going on. Typically for females, it's the vaginal canal, but sometimes we're dealing with a lot of really posterior issues. So we might talk about the anal assessment, and if you guys have guessed, yep, guys only have one hole, so that's the hole we go for. So one thing that we're looking for between us. But that is done to your comfort level with your permission. Sometimes we don't do that on the first visit, sometimes we don't do that at all because people aren't comfortable, but that gives us the most information. That lets us know how the scar tissue is moving, if you have scar tissue in the area, how the muscle's functioning, how it's coordinating together with other things, if you have any tense knots or trigger points. So this thing about, like, you ever get that knot up here in your shoulder? You're like, oh dear God, I need someone to put their elbow in this. I don't put my elbow in your pelvic floor, but I insert a finger into the vaginal canal, and can you see how some of these muscles, like, I wouldn't be able to get to them otherwise. Like, I can't, there's a bony thing all around it. I can't get to them really well. There's a few of them you can get to from the outside, but it lets me get on that tense, kind of knotted up spot and get it to release, because these are muscles just like anywhere else in the body. So they can be too tense and tight. They can be too wobbly and floppy and weak. So they can be anywhere along that spectrum. So we need to assess and see what's going on with them. And that's why I get really pissed off when doctors just say, oh, you have a pelvic issue, do Kegel exercises. That's like someone saying, oh, my shoulder hurts, do bicep curls, it'll make your shoulder better. Maybe, most likely not, because you never evaluated what's going on with them. You gotta see what's going on. And so to just tell someone to do Kegel exercises, a lot of times women are holding their pelvic floor muscles really, really tense and not letting them move and let go. And so telling them to do more exercises where we tense things up more is gonna make it even worse. And that's where a lot of people say they're like, Kegel exercises don't work. I was like, well, yeah, my pelvic floor was up here in my ears, and I tried to contract it more, and it's not gonna work. And that just makes my neck hurt. So, anything else I can answer for you guys? Was it what you expected? Did they give you good information? So homework going home, pick up the blueberry, but try it up, like try it down when you go to bed tonight. Try to take some big slow deep breaths and just see how that feels. See if you can get that umbrella-like movement. See if as you exhale you can pull in the belly and pull in the pelvic floor a little bit, and then let it expand out again. So try that to see if you can get that whole core canister working together. Cool. Thanks for having me.